Hello, everyone. Welcome to my show. Autumn is here. I'm Francine Crawford, your host. And today we have a segment about Alzheimer's. And we're going to speak to Dr. Osei Tutu. And he was here before, so you should recognize him. And we're glad to have him here on our show tonight. Thank you for coming, Doctor. How are you doing today?
Thank you. I'm well by the grace of God.
Good. Well, we want to talk about Alzheimer's. We know that it's part of dementia, and we want to get a medical perspective on Alzheimer's. We've talked about Alzheimer's on the show, but not from a medical perspective. So we want to get a medical perspective. So how would you like to start to talk about Alzheimer's and dementia?
Okay, so what I'd like to do is, start talking about how a patient may come to medical attention.
Okay.
Usually, it's the family who detect the subtle changes in the patient's behavior. Okay. Oftentimes, the patient who is affected by Alzheimer's may be oblivious to what is going on. Mm-hmm. And family members may, notice things that are, not normal. And a lot of times, these patients may resist seeing a doctor. Okay. So usually it's a family member who maybe drag the patient to see a doctor, and a lot of times these patients are initially before I even go into the symptoms and the diagnosis, I would like to first talk about the risk factors.
Okay.
Age is the number one risk factor. Anybody, who is 65 years or older, has a greater degree of developing Alzheimer's than somebody who is much younger, although there's a younger version of the disease that I'll touch on briefly.
Okay.
At age 65 or older, your risk of developing Alzheimer's doubles every 5 years. Okay, so age is a very significant risk factor. Next to age is there are these abnormal genes. There's a technical name for it which I'll not bother you with, but they are abnormal genes. If you have one or two of these genes, it increases your risk of developing Alzheimer's. Okay. And then third in line would be family history. If you have a strong family history of Alzheimer's disease, you are at risk. Mm-hmm. Female sex, for whatever reason, is also a risk factor. Mm. Then stroke, if you've had a stroke before, is a risk factor. Head injury is also a risk factor. And then, the last risk factor will be cardiovascular disease, heart disease, that sort of thing. Okay. So usually, the patient, the disease is very insidious, but progressive. Insidious means it's very subtle. Mm-hmm. And if one does not pay attention, they may miss the beginning signs of Alzheimer's disease. Oftentimes, one of the cardinal manifestations of Alzheimer's is forgetfulness. Mm-hmm. Patients may start to forget about, simple things. They may start, misplacing things, and they may forget, doing, things like paying bills, ordinary things like that. Mm-hmm. Sometimes they may get lost, driving, even to familiar places. Mm-hmm. And then, when they are in unfamiliar places, they may, become very disoriented. Okay. So these are all symptoms of that. And then, one of the very important things that one can also see in people with Alzheimer's is, they may have difficulty expressing themselves, like word finding, and sometimes also they have problem with organization. They become disorganized.
Okay.
So all these are manifestations of Alzheimer's disease. There's also a psychological component whereby sometimes these patients may become depressed, especially if they recognize their deficits. They may become depressed, anxious, apathetic, and sometimes even agitated. But it's usually. Go ahead.
Can I ask from medical perspective, when these things are happening, what's happening actually inside of them? Like, is it attacking their brain in what way?
Yeah, I'll go into that in just a minute.
Okay.
I'll go into that in just a minute. There's a particular protein that is, it's called amyloid.
Okay.
That, and there are two types of protein that are, infiltrating the brain and causing, nerve connection or, transmission of information, interfering with that. So that's the underlying pathophysiology, but I'll address that in a minute. So, usually people with Alzheimer's disease will not have problem with their movements unless, in the advanced stages of the disease, where they may have some problem with movement and coordination and that stuff.
Okay. So
usually when a family member sees one of these patients, they may say, oh, the patient, our loved one may have dementia. Let's go and see a doctor or a neurologist. Essentially, like with any medical diagnosis, you have to get a very, very good history. In instance, the patient or the subject, is usually not helpful because, they are having memory and whatever. So the family member who, lives with them would be very key in providing the information as to why they think the patient may be having some kind of dementia.
Okay.
So usually, the evaluation begins with a good, a thorough history from a family member, and then the doctor will do a physical exam. And this is like, medicine 101.
Okay.
Based on these two pieces of information, the doctor may have a heightened degree of suspicion that the patient may have dementia. One of the common things that we'll do is ask the patient simple questions. Give the patient maybe tell the patient to count from 1 to 10, and they may not be able to do that. Or tell the patient to count backwards from, say, 10 to 1. They may not be able to do that. Tell the patient to add two things and give you the answer. They may not be able to do that. Okay. And, oftentimes we'll ask them to, identify certain objects. Like you put a clock in front of them, ask them, what is this? They may not be able to tell you what it is. Simple things.
Regular normal things.
Regular normal things. So all these things are building up to the diagnosis of dementia. Now, dementia, there are about 5 different types of dementia, and any one of these types can be the same presentation. However, Alzheimer's dementia has unique features that is distinguishable from the other types of dementia. Usually, Alzheimer's will present initially the cardinal feature of Alzheimer's dementia, at least initially at presentation, is the memory problem and the forgetfulness. In other dementia, memory would be the last, the end or an advanced stage of the disease. But Alzheimer's usually will present with memory issues earlier on than other dementias. So the history and the physical exam, one of the things that you're also looking for is maybe diseases that are remediable or correctable. So you have to put that in your differential, being that Alzheimer's is by and large not a reversible disease. So you always have to make sure that what the patient is manifesting is not something that is correctable. For instance, sometimes people can have dementia because of a vitamin deficiency, or even third stage syphilis can present as dementia. It's a form of dementia.
Mm-hmm.
So in the workup, oftentimes we do B12 and vitamin B12 and B6 level, check syphilis serology, because these things are correctable. So in terms of the diagnosis, the physical exam, the history and the physical exam is going to help you, make a generic diagnosis of dementia, but really pin down the diagnosis of Alzheimer's. MRI is very, very important. And usually do an MRI, you have to see what is called a generalized loss of brain volume. In other words, the size of the brain is going to be smaller. But even more importantly, there's this area of the brain called the hippocampus. And if you see the hippocampus, the volume of the hippocampus smaller relative to the overall size of the brain, mm-hmm. it almost confirms the diagnosis of Alzheimer's. Almost, not 100%, almost. That's key. So MRI is very important. The other thing that is also very important is sometimes the MRI may be normal, even though you have a high risk of suspicion that the patient may still Alzheimer's. In that instance, you do a test called the PET scan. Mm-hmm. The PET scan is a functional scan where we inject a special glucose labeled the parietal lobe and the temporal lobe of the brain on both sides. Okay. The function is diminished. That's so another telltale sign of Alzheimer's.
Okay.
Then, on top of that, sometimes we also do a spinal tap where we put a needle between, and get fluid. Mm-hmm. This fluid is the same fluid that bathes the brain. And when we do that, we are looking for two proteins. I don't want to bother you with the names of the proteins, but one of the proteins, if it's low and the other protein is high, mm-hmm. it's highly susceptible of Alzheimer's.
Know someone who they were fine, they were well, they were okay. They got sick in the hospital, a physical sickness, like they broke their hand or something. And then while it was in the hospital, or actually went to a rehab, they got a UTI. And when they got the UTI, mm-hmm. They didn't know at first they had it, but they were acting different. They were acting strange. They're up in their 80s, and they were acting strange and things like that. And then when they discovered mm-hmm. that they had a UTI, they realized why they were acting not like themselves in their brain. They said it affected them. Yeah. So they took them to the hospital and they treated it. But after that, she started forgetting. Now she was up, she was very conscious and she knew who everybody was. But after that, she started forgetting. Her memory started mm-hmm. going. That affects, like the UTI in someone older affects their brain in that way that it can affect their memory?
No. Most elderly people, if they have any acute illness, can have problem with their memory. And once you treat the acute symptom, acute whatever, UTI, pneumonia, mm-hmm. Any acute medical problem can, cause them to have memory issues or not act right. And once you treat that, usually the memory issues will go away.
Okay.
So after this patient was treated and the memory symptoms did not go away, you have to look deeper. Okay. Could she have had a stroke in the course of while she was in the hospital? Right? For something to present acutely like that, when she was always, fine and usual state of health,
Right.
you wonder if there was something acute that occurred while she was in the hospital.
Okay.
And a patient like that, you have to make sure they didn't have a stroke. So I'll definitely do an MRI of the brain to make sure something is going up,
Okay.
something acutely, is going on.
Okay. So once you are diagnosed with Alzheimer's or dementia, once you are diagnosed with it, what are some of the treatments that they give you to do? I know there's no cure yet, but I'm sure there are treatments for people to get. What are some of the treatments?
Right. Okay, so I'm in medicine. Okay, you always want to. A lot of people don't understand, especially patients, some doctors. There's one, yes, you are trained, you have a degree, you can prescribe whatever, but you always want to juxtapose the benefits of any type of treatment or intervention vis-a-vis the harm that it can cause. And usually if the benefits outweigh the risks or the harm, go for it. Okay. If it's 50-50, you have to have a good conversation with the patient. This is it, and, support whatever decision the patient makes. If the risk or harm outweighs the benefits, don't do it. Okay. Because, the oath that we take is first do no harm. So if at any point in time your intervention is going to cause harm to a patient, that's where you draw the line. The treatment for Alzheimer's, okay, there's a medication in the brain. The thing that helps us with memory retention is called acetylcholine. It's a chemical. That is what helps us with our memory. So the thinking is, and acetylcholine, when it's produced, is then broken down by an enzyme. There's an enzyme that breaks it down and then it's recycled or whatever. Mm-hmm. So the belief is, and whether it's true or not, I'm not sure. The belief is anybody who is having memory problem, maybe if we could find a way to increase their brain acetylcholine levels, mm-hmm. then we can stem the tide of the memory loss or improve their memory. That's the thinking. So most of the medications that initially came out that are being used to treat Alzheimer's prevent this enzyme that breaks down the acetylcholine from doing that. And in so doing, elevates the level of the acetylcholine in the brain. So if you don't break down the acetylcholine, then it accumulates, right? And hopefully that is, if your theory is right, is going to help with the memory. Some of these medications have more side effects. Another medication actually two medications that came out, one as recently as last month, where a lot of doctors, a lot of the expert people on the panel, FDA panel, really disapproved, did not want it to come out because of the side effects or whatever. But the majority rules or whatever. So the medication is out there now, and it's not cheap. It's like $26,000 a year. And then there's another medication that preceded it that also has a lot of bad side effects. And it does not, it's one thing if it has a lot of bad side effects, but then it helps the patient improve their memory. And a lot of these medications, they actually don't. They're very, very minimal.
So your message is to when you are prescribed with medication to take care of Alzheimer's or to help Alzheimer's, you should ask what the side effects are first.
Definitely.
And then make the decision of whether you should take it.
Have a straight talk with the doctor, because it's not like, having diabetes and I give you insulin or sugar pill. I know it's going to drop your sugar.
Right.
If I get overzealous and give you too much, it may drop your sugar precipitously, and then you are going to have a different problem with hypoglycemia. But this medication is really these Alzheimer's or dementia medication at best, that the benefits are are not that great, and you have to juxtapose that with the side effects of the medication and the cost. The cost, if your loved one is sick and they need something, the cost is irrelevant. Right. But is the medication going to help them or reverse the process? And they don't. Let me also say one thing quickly. Okay. As I mentioned to you, Alzheimer's is caused by these abnormal proteins that are infiltrating the brain, and they are called amyloid and tau proteins that are messing with the activity of the brain function. So if I gave you something to elevate the chemical that we believe helps you with your memory, that chemical is not doing anything to the underlying process that is choking your brain cells and preventing your brain cells from working appropriately, right? Okay, it's not preventing the amyloid. It's not preventing that. Right. Yeah, it's not preventing that. Right. Now, if you gave that to me or you, maybe it will help because we have normal brain function, right? Right. So, and if we have normal brain function, then we don't need that, right? Right, right. So what they are doing right now, which I think is very neat, is they are trying to come up with a monoclonal antibodies. Okay. Monoclonal antibodies are antibodies that, supposedly would go in and remove the bad gene. Okay. Right. So that's where the thrust of the scientific work is right now. Monoclonal antibodies.
Is there something that people miss with Alzheimer's? If a patient comes into you, or that you've noticed that that's missed, that's a regular, normal thing that people think, let people go, and it's worse. It is Alzheimer's or it is dementia.
I think okay. So dementia is the catch-all term, and then under dementia, there are several types. Alzheimer's is the most common cause of dementia. Right. Alzheimer's is the most common cause, and usually it's the family. The family is very, very, very important because the doctor does not live with the family, right? The family lives with the patient. So once the family member brings the patient in and tell the doctor, look, this is going on, or all that, then it will, but the doctor, because the doctor is not with the patient all the time. The patient may come in for their physical or whatever. And initially, when the disease is first presenting, the manifestations are very subtle. And in this day and age, especially when doctors, the moment you start opening your mouth, they are writing you a prescription because they have to see so many patients. The interaction with the patient is not that, extensive or meaningful. So yes, they can miss. Right. They can miss. Right. They are seeing the patient every 10 months, or they come in for their 15, 20, half an hour. Right.
So that's why early on. Yeah, that's why we want to give people information, because if your doctor doesn't suggest anything, or you can ask the questions. You can ask questions about it. So that's why we want to give people information on it and what to look for. And like you said, the test that you can possibly take, because sometimes they go in and they take a test, and it's they don't refer to the PET test. They will do, sometimes they'll do like an evaluation test. Like you said, the questions, they'll ask you questions of normal, regular things. But sometimes with dementia or Alzheimer's, you're not going through it always. So I've seen where they ask a question to someone who that has this, and they're sitting down and they're calm and they answer all the questions right. And you're like, wait, just a few minutes ago, they didn't know that.
And you take them home.
And you take them home, but something is wrong, but they pass the test.
So you have to be an advocate. You always have to go with them. And the thing is, if I see somebody, so you are the one who is going to raise the high index of suspicion for the doctor, even the doctor who does not have time to see the patient because they are busy or whatever. Mm-hmm. When you go in and you say, Doc, I think that, my loved one may have dementia or something may be going on. At that time, you are raising the antenna and they are probably going to say, okay, let me give them a referral to go and see a neurologist. You have to see a neurologist. Okay. That's key.
That's good.
You have to see, and this is not something that your family doctor is going to, they have to see a neurologist.
That's good.
Okay. Yeah. And when you raise that concern, the light bulb goes up. It flick, and then everybody, okay, let's try to, see what is going on. And then they may run the necessary tests and detailed psychiatric evaluation and all that, and then make the diagnosis.
So do you have any optimism that there will be a cure at any time? Do you think that?
I have optimism. And I'll tell you why. Yeah, I'll tell you why. When I was in training in 1984, 85, in the period of the AIDS crisis, everybody who came in, okay, I was at New York Medical College in Valhalla. When you saw a correctional officer posted in front of a ward, usually it was a patient from Sing Sing or wherever, all right? And these patients were having diarrhea, pneumonia. In other words, we only had AZT, only one drug at that time. People were dying left and right.
Yes.
They were like skeletons, right? I mean, I saw somebody's mouth grow fungus at Lincoln Hospital. I went there for 1 month before I finished my training. Guy was talking and everything, was shooting, AIDS guy, okay? And compared to now, and then we had like probably 32 medication cocktail. Right? That was keeping people alive or what. And now we only have one that has 2 medications. And people are living a normal, healthy life. Look at Magic Johnson.
Yes.
Right? Magic Johnson contracted HIV in 1992. He's healthy as hell.
Yeah.
Right? You look at this, leukemia, childhood cancers. Now, most of them are curable. So I'm very optimistic, that we are going to find a cure. I'm very, very optimistic.
Okay, that's good to hear. That's good to hear. And you're right. Sometimes we have to remind ourselves how far science has come and how many other things that have been, people thought was a death sentence, and now they have pills and medicines that will, prolong your life or cure it. So, or let you live with it. So that's really positive and optimistic. I'm glad that you mentioned that. So, is there anything else that you would like to say to somebody who's dealing with Alzheimer's or has a loved one that's dealing with Alzheimer's? Anything that you would like to add, to look for, or any help out there?
Once the disease is established, then they have to have a good family support system, because this is a progressive disease, and they are going to get increasingly worse. And it's really I wouldn't say a burden, but it's taxing on people who care for loved ones who have Alzheimer's. One of the things that I would mention before we conclude is the belief of a lot of the experts believe that having cardiovascular disease increases your risk for Alzheimer's. And cardiovascular disease, the predisposing factors to cardiovascular diseases, majority of the predisposing factors are high blood pressure, diabetes, high cholesterol, and cigarette smoking. So if you can minimize your risk factors for these cardiovascular, disease risk factors, it may help you to prevent Alzheimer's.
Wow.
Those are preventable things, right? You don't smoke, you have diabetes, you control it. You have high blood pressure, you control it. You have high cholesterol, you control it.
Yes.
They may lower your risk factor of getting Alzheimer's, because it's one of the risk factors associated with Alzheimer's disease.
Okay. Wow, that's good information.
Mm-hmm.
So yeah, that's what we know. We have to work on that. We have to work on other things that will affect it later. So thank you so much for coming on to Autumn is Here. One more time, we appreciate your knowledge and wisdom, and that you're wanting to help to get the word out and get any kind of education on any kind of medical stuff. So I appreciate that. I'm hoping that people listen and they take information, and they're not afraid to speak up with the doctors, and that they get more involved with their loved ones, their family members, because a lot of times, like when my mom went to the doctor, she always went by herself. I never thought anything of it until one time I went and I asked, because she was acting strange, so sometimes you can't wait. You gotta go visit with them. I know they seem like they're okay and they handle everything for years, but it's good for you to go visit with them and just know their medical history, talk to their doctor, and explain certain things.
The other thing is, people of that age or era, they are very compliant. They don't question doctors.
Right.
Whatever the doctor says, these doctors, they pat them on the back. They've known them for all these years.
Right.
But when you go there and, you are going to, last but not the least, this is very important. Social services, right when you realize that your loved one has, Alzheimer's or dementia, you have to enlist the support of social services, because you are going to need them.
Okay.
And then try to join a support group, Alzheimer's or dementia support group, because they are a wealth of resource that you can tap into.
Awesome. Yes. They need some help to help caregivers to help their loved ones.
Right.
Well, thank you again. Thank you for being on the show. I appreciate it, and hope to see you again. Okay.
God willing. Good Lord willing.
All right. Good night.
Good night. Bye-bye.
Bye-bye.
Bye.